So, good morning, and thank you for joining us for this Policy Interested Parties meeting. My name is Fatima Mirza, and I'm the Program Case Manager for the Medical Commission. This meeting is being recorded. The purpose of this meeting is to collaborate with interested parties such as the public, association members, physicians, and physicians' assistants regarding our policies, guidance documents, and interpretive statements. The documents which will be discussed here today are available on the policy meetings page on our website, which is wmc.washington.gov. Attendees, if you would like to ask a question or speak, please use the raise hand function or the chat. When commenting, we request you avoid commenting on ongoing investigations or disciplinary cases. Please make sure your comments pertain to the agenda items. Do you have any questions? Not seeing any hands, so I'll pass it over to our policy manager, Khadija Keita, while I pull up the agenda. Thank you.
Good morning, everyone. I hope you can hear me.
We can.
Okay, thank you. Good morning, everyone. Thank you so much for joining us today. And we have 5 documents on the agenda, 2 of which are guidance document and the rest are policies. So the first one is ownership of clinic by PAs. So this is a guidance document that we had. So it's just give like some of the guidance that we have when a physician assistant have a clinic and then they happen to employ their supervising physician. So they need to make sure that they follow all the ethical and the legal standards and then prioritize patient care and also report any misconduct regardless of who own the clinic. So if you have any questions or you have any concern with the language of this document, you can please raise your hand. I'm not seeing any.
Yeah, me
So
neither.
we will move on to the next one. The next one is a policy statement and it's about self-treatment and treatment of immediate family members. So the commission advises that practitioners generally should avoid treating themselves or also their family members due to the risks of objectivity, communication, and boundaries. Exceptions are like emergencies or minor short-term issues, but those should be documented as well. And they are also advised not to prescribe any controlled substance medication for their family members, and also not to access their family members' medical records. So again, if you have any concern with the language of this document or the structure, you can please raise your hand. I'm not seeing any hands, so we can move to the next one. And this is also a policy statement. It's about terminating practitioner-patient relationship. So the commission advises that when you're ending a practitioner-patient relationship, practitioners must make sure that they do it professionally by providing written notice and also offering ongoing emergency care and also facilitating the record transfer using a certified HIPAA compliant electronic system to the new provider. And then also they should follow all of these steps to fulfill the legal and ethical duties and then to prevent any claims of patient abandonment. So if you have any feedback or concern with the language of this document, you can please raise your hand. I'm not seeing any hands, so we can move to the next one. So the next one we have is also a guidance document, and it's on overlapping and simultaneous elective surgeries. So on this document, we give the definitions of the two different type of surgeries, and also the guidance of what they should do if an attending physician happen to do all of this. So when we have the general principles, and we also have the consent, the patient should be informed that you're doing this type of surgery when you're doing their surgery. And also it should be documented. So when and how it happened, when do you enter the room, when do you leave the room, and who was supervised when you left. So if you have any other concern about this document, the language and the structure, please raise your hand. And I'm not seeing any hands, so we can move to the last one, which is also a policy statement and is on discrimination in healthcare. So it is a document that we provide to make sure that we have an environment where everyone is treated equally, and everyone is treated like with dignity, respect, and also provide equal opportunities in the healthcare delivery system regardless of their background. So if you have any feedback or questions about this document, please raise your hand or use the chat function. I'm not seeing any hands, and this is all I have for you today. Thank you so much, and back to you, Fatima.
Thank you, Khadija, too. So now this is the time where interested parties like you can share your thoughts and suggestions on the WMC's policies. We encourage everyone to participate and express their ideas respectfully. If you have an idea for a policy or suggestions to reform an existing policy, please use the raise hand feature within Teams. And you will be called upon when it is your turn to speak. When sharing, please remember the WMC regulates allopathic physicians or MDs, physician's assistants, and certified anesthesiologist assistants. If you have an idea for a different profession, feel free to send it to the email address on the screen and we will forward it to the right place. Well, I'm not seeing any hands or chat messages, so I believe that concludes this interested parties policy meeting. Thank you everyone for coming.